My name is Marinette, and I'm ready for MyChart.
Welcome to MyChart, Sunnybrook's personal online health management and continuity of care record service. MyChart is designed specifically for the health consumer, for patients, and through them, for their families, physicians, and personal care participants.
The ability to access my record, my health record, anywhere, anytime, creates a sense of confidence for me when I'm traveling or even just when I'm having my conversation with my caregiver.
We talk a lot about patient engagement, and we talk about the patients being at the center of what we do. One way that we can tangibly do that for our patients is to give them access to their information, give them access real time, give them the same access that our clinicians have. That will allow our patients to truly be at the center of their care and at the center of the care team.
MyChart has been in production since early 2006. It is an online service to help patients and their families better manage and capture their own health information all in one record. MyChart empowers users with sharing capabilities. This means a user can share access with multiple physicians, clinicians, and family members from anywhere at any time. Today, Sunnybrook's MyChart is accessed globally from many countries around the world.
We are taking two incredible technologies, Clinical Connect and MyChart, and bringing them together. The marriage of these two is just going to open it up wide open for the patients and the ability for them to get access to their information and to be able to really start to take control of their health journey.
One of the things that patients don't have access to is the very patient information that's resident in their clinical records in our hospital and in the hospitals that have seen them across our region. And that's why we're so enthused to have implementation of MyChart with our Clinical Connect portal to be able to allow patients in our cancer program across this region to have access to the vital information about themselves as they walk this cancer journey.
I have been to about 12 different hospitals, maybe more. Having the ability to enter a lot of that information into MyChart for myself, and the ability to share that with my other doctors is completely awesome. It saves me so much time.
The one nice thing that MyChart and a patient portal is going to provide us is the ability for the patients to start entering their data into the system. And that's one of the key components that we know as we're looking at that journey, is understanding what the patient's feeling and how they're seeing their care, and being able to marry that together with the clinical data that we're already collecting.
We're going to start initially with breast imaging, and hopefully we can take it further after that to other fields of radiology. The good thing is that it gives the patient access to their report.
I was able to go into MyChart and look at any of my lab tests or any of my other tests, my radiology tests, my MRIs, my x-rays, and I was able to share those with people that I trusted.
To sign in to my MyChart account, I go to www.mychart.ca and type in my user ID and password in the login box. I can view all my medical imaging results by choosing Radiology. I can share information with my physicians, family, or other care participants. The personal record features enable me to manage my own personal health information all in one place, one record. I can log entries under allergies, appointments, appointment requests, conditions, diary, and tests. With MyChart, I can upload external results from non-member facilities to my personal health record. I can edit my profile by clicking on Manage My Account to update my user ID, password, or any personal information.
Putting patients first is on the forefront of everybody's mind right now, and this truly does that. Patients are more empowered. We have more devices at our hands and our control. And yet the one thing that we tend not to have access to is health information. And so this will be the first time that we're really able to provide that information in the hands for patients. And I think it's important that we're able to do it in a consolidated way rather than patients ending up with 6 or 7 or dozens of different patient portals that they might have to go to.
Patients who will have access to the information will have access from all the different places that they may visit. So if they see a patient encounter in Hamilton and they come receive some additional treatment in London, they will be able to access that through a single portal. This portal will be the largest portal in Canada.
Working with Sunnybrook's MyChart that's already being used for hundreds of thousands of patients across the province is going to allow us to take its functionality to the next level for patients. It's a great partnership and something that is really attractive about this project and this work.
Bringing all of that regional data together allows us to have that wholesome view of the patient and the patient to have a wholesome view of the healthcare journey that they're undergoing.
Consolidated, centralized information, as well as being portable, it allows me to have better conversations with my caregiver. It allows me to be prepared to have that interaction. It allows me to get more information about my diagnosis or about my personal health.
MyChart is coming and we're ready.
We're ready for MyChart!
Having MyChart be available, all I can say is it's about time.